Garth Martz has been with us before. This is his second time presenting with us. We're excited to have him back. He is in private practice right now in a tiny town called Eagleville, Pennsylvania. Does anyone know where Eagleville, Pennsylvania is? Do you know where Philadelphia, Pennsylvania is? It's near there. That's what he told me. Okay. So you have his bio, so I'm going to read it because maybe you haven't read it yet. He is a licensed psychologist with over 25 years of experience in the treatment and management of gambling and other addictive disorders. He was formerly the special assistant to the secretary for the Department of Drug and Alcohol Programs in the Commonwealth of Pennsylvania. Dr. Martz has a doctorate in clinical psychology from the American School of Professional Psychology. He has a dozen publications, including the international best-selling Manage My Emotions, What I Wish I'd Learned in School About Anger, Fear, and Love. He has over 100 local, national, and international presentations on addictions. Let's all welcome Dr. Martz.
Testing. All right, I like it when it works. So welcome everybody. Welcome everyone. So a couple of things. I am one who always enjoys being here early to find out what was being said before me, because there's sometimes really important things that go on that I have to borrow and grow, because in my mind, and as you'll understand in a moment, that this is an ongoing conversation. All of this is an ongoing conversation. There's been a theme already today about the past, present, and future, and you might hear about that from me as well. I loved it when we've already got emotions getting into the conversation before me. I one day went back into the treatment program, and I didn't make it past the door before a client walks up to me and says, Ken, you were on TV last night, and you didn't make it 5 seconds into the interview without saying feelings. Well, sorry, it's kind of important. We may be going to talk about that a little bit today, about why that is so important. So before I go any further, I've got to pick up also for a second on this issue of rituals. Rituals. Very, very important. Some of you will understand immediately when I start to say, as we're coming back into the room, good afternoon, family. Welcome back from lunch. I joke about it sometimes because I am in the room of, I often get put right after lunch. And I usually take that as a great compliment because somebody thinks I can keep you awake after lunch, right when all the food starts kicking in. I don't know, but it means a couple of things. That I've got a couple of slides to go through. It means I'm going to talk really fast. And it means this is an ongoing conversation, past, present, and future. We're already continuing from what's been said this morning for what we'll continue to say in the afternoon. I will be happy to always discuss these things further as we go along. So we've heard a little bit about my bio, and I'm not all into that stuff, but I always do want to consider that this is an ongoing dialogue, so feel free to continue to reach out to me along the way. A couple of things we're going to try to touch on today, and again, I'm going to skip over a few of these for various purposes. We're going to talk a little bit about relationships, and didn't I already start saying, good afternoon, family? What the heck does that mean? In some treatment traditions, that's a traditional greeting, okay? Why the heck would we say something like that? Oh my gosh, family, yes, brothers and sisters, we are together in this world, in this progress, in this process, and the relationships matter. And so we're going to be talking about that a bit today. How do these relationships matter? That the relationships are critical for the healing process. Now, think about this. You maybe have a boss that you respect somewhere, maybe not today, but maybe someday in your past. Wouldn't you work harder for that person that you respected? Thank you. Got it? So consider that. Our relationships matter. If we walk in and our client hates us, they're not going to want to continue. And if they don't continue with us, where are they going to go? Relationships matter. We're also going to talk, of course, about feelings, because I love that stuff. So, as I mentioned, without being put in there, we're going to talk a little bit about where we've been, where we are, where we're going. All right? I'm going to give a brief history. I'm going to do 1,000 years of history, 100 years of history in a little bit of time. But first, I want to ask a quick couple of questions for your consideration. since the work starts with you. So, for example, do I believe that an individual can change? Thank you for saying yes. Don't we all think the answer is yes? That's why we're here, right? Did anybody see that slide this morning? Just rips at me when it says 25%, 1 in 4, don't believe that folks with an addiction can change in this day and age. 1 in 4 say, forget you. No hope for you. I've done this work for many years now, and I've actually had someone say to me, well, why don't we just take all these people and put them on an island somewhere? I said, you really don't understand, do you? The belief that we can change is critical. Now, I can spend a lot of time on that, but I'll be brief for now. It seems a simple question. It seems an obvious contrast, but I invite you that it's a little more complicated than that, isn't it? Has anybody ever heard a phrase something like, once an addict, always an addict? Huh. I've had a client I was working with one time. I can say that again now. I love it. It's like I worked with the state for a number of years. I managed the gambling budget for Pennsylvania, and there were all sorts of restrictions for the state. And now I'm back in private practice, so I can actually talk and be free again, which I love the whole point this morning of how do we get out there and have these honest conversations? Because it's only when these honest conversations that occur in the context of relationships that we can really move things forward. Had a client who says to me, you know, my gosh, I've been to like 3 therapists in the last year, and you know, you're the first one who hasn't talked about my depression, anxiety, drinking like a terminal illness. And all of a sudden, my life's changed. And thank you. How do we thread this needle of addiction as a process, recovery as a process, with change as possible, while I may still be not going back to certain behaviors over a course of a time? Seems like a simple conversation. Can we change? May not be as simple. We had that thing about gold standards we talked about today, too. What is the fuel for our beliefs, behaviors, and motivation? Everybody talks about MET, motivational enhancement. Okay? I fully agree with it. It's a wonderful practice. I would invite you that there may be one thing missing from that group, which is feelings that motivate us. Feelings that motivate us. Are there certain emotions that I try to label as bad or try to avoid? Anybody ever said, no fear? There's like t-shirts out there that say, no fear. You know, like that's a good thing, right? We can't live without fear. But do we have some of these conversations within ourselves? I believe that anger is bad. We heard about anger before today. We heard about grief. Is grief bad? Well, I don't want to have grief. I'll do anything, but don't give me that grief thing. You know, we need all of these. That's the richness of life. It's our motivation throughout the circle of life. Do I believe that I can achieve these things that I want? Some of our folks that you may meet don't believe that they can change. Critical issue. First question is, do I believe that they can change? Because if I don't believe you can change, I'm not going to help you. If I can't lead you there, if I don't have the hope or vision beyond today, I can't take you there, ever. Sorry. But if you don't believe that you can change, which may be part of why you're there, we can work together. Okay? Critical pieces. Consider the following, that for the purposes of this conversation today, I will be using the term addiction as both inclusive of substance use and behavioral processes. Addiction is really trying to bridge that edge. We've moved into substance use disorder and labels like this with the mild, moderate, severe, which I like, and there's some value to that, but understand that severe use disorder, gambling disorder, is qualitatively different than mild substance use disorder or gambling disorder, and might have different interventions necessary. So when I use the term addiction, I'm specifically speaking to what we would consider a little bit further onto the spectrum, not the person who had a couple of too many drinks after a wedding and got a DUI. I will put you for conversation. Addiction, the more severe versions, is a disease of hopelessness, is a disease of shame, and is a disease of isolation. Do you see why I began the conversation with, good afternoon, family? When we start progressing in our addiction process, we often move further and further alone. We often move further and further into our shame, things that we've already been hearing about today. We often move more and more into hopelessness. I don't believe that I can change anymore. I've tried so many things and nothing's worked. If I don't believe I can change, who are you to tell me that I can change? They may walk in with a certain conversation. So, what if we were wrong? Some of you may know the story of the elephant and the blind men. So the first person walks up to the blind man and first blind man walks up to the elephant and says, "Aha, an elephant is like a spear. It's long and pointy and pokes you." And the next blind person comes up and says, "Aha, the elephant is like a garden hose. It sprays water at you and it's long and lanky." The next person says, "Aha, elephant, it's like a large bay leaf." The next person says, "Oh no, it is like a wall. Oh no, it is like a tree trunk. Oh no, it is like a rope." Very often we see pieces of a puzzle and we move into, aha, this will be the cure. This should be the gold standard because this is the piece of the puzzle that will fix this. What if we made a mistake in life? I have to do a very brief travel through time because sometimes we make mistakes, but we learn from those mistakes, which is very important because that's what we do, right? We learn from our mistakes. There was a time where we have traveled back. In 1895, you may have heard of a company called Bayer. It's most well known for its aspirin, correct? Well, in 1895, it wasn't aspirin, it was Bayer heroin. Bayer heroin. You can see up here, the kids love it. It was a cough suppressant. Kids love this stuff. It was awesome. Bayer heroin. Little fun facts from our history. But we learned so much better than that. Since then, we moved over into the 1990. We had Coca-Cola. Some of you may have known this old recipe from Coca-Cola. You can see the coca leaf, the cocaine leaf, in the Coca-Cola. It was awesome. Freud used it, said it was wonderful for elating your spirits. We've since learned better than that. We don't do that anymore. So we moved up to this century. We got 1947, and we found that 20,000 physicians said that Lucky's are the best cigarettes ever. Lucky's are the best. If all these doctors think he's the best, you should be smoking. You should be smoking. All these doctors tell you it's the best thing there is. No. We've learned from that. We moved to 1966, and we now have benzodiazepines. Benzodiazepines being placed out there as mother's little helper. You're stressed? Go ahead and have some of our benzodiazepine. You will love your kids again. Mother's little helper. Oh my gosh, I should have also warned you, but once in a while I get a little bit finicky. So you may find that I might perturb somebody once in a while. I should give you one last warning, that once in a while, there's research out there that says we often go to trainings and then we go back to our offices and don't do anything differently. I would invite you to not do that. I'm sorry, I meant to include this warning at the front end. I invite you that if I don't perturb you in some way from doing what you've always done in your practice, in your past, then we haven't changed our future. So I'll invite you that this, and not just this hour, but this whole conference, please take the things that you're learning, take it back home, use it, make a change on Monday. We need to learn from our past because we are better than they. So, we learn from our past. Oh my gosh, this one. This is the famous Porter and Jick study. It says, addiction is rare in patients treated with narcotics. Letter to the editor for the famous, prestigious New England Journal of Medicine, 1980. Recently, we examined the files of 40,000 hospitalized patients, blah, blah, blah. We conclude that despite the wide use of narcotics, the development of addiction is rare with no history of addiction. By the way, this is the entire study. We just read it. It is a letter to the editor. It is the entire study. Addiction's rare. You're not going to get addicted to narcotics. Couldn't happen. Oxycontin, fine. No problem. We've learned that since 1980. However, 1989, the National Institute of Health identified this study and said, consider the work of Porter and Jick. Scientific American said it was an extensive study. I don't know about you, but that doesn't look extensive to me, but that's anyway. Anyway, 1995, Canadian Family Physician said it was persuasive. It was a landmark study that says it was basically unwarranted to think that you could ever get addicted to opioids. 2007 textbook says that it did much to counteract the fears that you could ever become addicted. This was studied by 161 studies as of PubMed, up to 1,400 studies as of Google Scholar. So somewhere between 100 and 1,400 times, this study that you just read in 30 seconds has been cited, saying that opioids are not addictive. But we've learned better since then. We may have heard this opioid addiction thing, right? It actually became worse as we moved into opioids for pain and ran into issues where there's a wide range of pain management tools, and we've since had to pull some of those back and begin to use other tools as a part of that process. We've learned so much since our time. So where are we now? Let's learn something from our past and not continue that any further, right? We are now in a different place. We are now in a place where substance use disorder and gambling disorder have dramatically increased. You may have heard of this thing called COVID out there. I hear it's going around out in the world somewhere. You may have heard that amongst the lists of those who have become ill or died, there's a substantial amount of fear, grief, loss of joy, and isolation. Addiction is a disease of illness, of isolation, of hopelessness. Current areas of focus, you may have heard some things out there. I love the acronyms. The acronyms are going to save us, right? Because we've learned from that, right? The acronyms of the best practice of the day, the gold standard of the day, and the funding stream of the day, shall we say, begins to get us into all sorts of things, such as we're going to now do routine screenings for various things at the hospital. We're going to use evidence-based practice, which, by the way, if you haven't guessed, I'm a research person. I love evidence-based practice. I invite you to always look at original studies, not just take what somebody else said, because otherwise, like the New England Journal of Medicine says, it might be wrong sometimes. Very important. Look at original data. How many medications are offered in your program? Use of placement criteria such as ASAM has been used for a lot of things. We've got a whole thing going on in Pennsylvania where they're trying to change over which tool we place people into the program with. Okay? Because we need to be learning a new tool rather than talking with our clients. I've seen a program that had 95% compliance rates on their paperwork, meaning the counselors were getting all their notes in and everything was right on time, and they were using the acronym of the day, and they had a 10% retention rate. 90% of the clients were leaving against medical advice. What do you think is going on there? They're doing the counselors are sitting in the office writing paperwork, not connecting with the clients. The relationship. Did I mention that one yet? Sometimes you have to say things 7 times to get it right. Oh yeah, paperwork. There it is. It's in there. Outcomes. They're trying to take some of these, particularly CMS, taking some of these federal things from the healthcare system and apply it to the addictions world. And so I had a counselor comes to me and says, yeah, I had to I was calling the insurance company and I had to go interrupt a group to pull the client out so I can find out what their BMI was so I can get the authorization for additional care from their, I'm like, wait, no. Wait, what's going on here? So what's BMI? I had to ask that because I couldn't mean the same thing to you that it means to me, because why is the insurance company holding up whether or not you can be in treatment because they don't know what your BMI is? And you need to be pulled out of group. Funding is central. And funding needs to be adequate to manage a relationship, so I don't have to tell you you got 2 days covered. Okay, Ken, I'm going to go and let me tell you about the trauma. I trust you, Ken. Now it's the time. I'm going to tell you about what happened when I was 6 years old, 8 years old, and the trauma that happened to me at that age. 2 days later, the insurance company says you're no longer going to be able to work with me because they said you're cured, you can be managed at a lesser level of care. But I'm working with you about what happened with me when I was 8 years old and the trauma that I had. Relationship. And how do we fund and treat people in a way that will build relationships that matter? think about, I always say, I love the quote from this morning, what does the person with the disorder need? Where is the person at the center of this? What is meaningful of treatment? To answer that question, I'm going to go briefly to the future. Actually, no, this one's still a little last. But create still a future of what does it look like to be in recovery in long term? So there's actually not as much out there as I would love to have on this in research-wise, but I do find a few out there, one of which is that what was different on your last quit attempt? The number one there was 12-step affiliation. Immediately following that was good support, and then tired of the lifestyle. Okay? Do you hear the theme that starts to emerge also about connections there? Relationships matter. If that doesn't work, we've got, this one is a drug and alcohol survey from Faces and Voices of Recovery, the National Organization for Drug and Alcohol Recovery. Average of 10 years in recovery, they identified regularly that was still, even 10 years later, an active state in recovery, 75%. 95% had attended some sort of 12-step fellowship meetings of some sort. They are the only ones that I've seen that have done a good job with this. Think about this. This is people who are 10 years in recovery, right? So 10 years in recovery. So you can begin to see what you may not be able to see clearly, but you'll quickly get the picture, that these small lines there are inactive addiction. The red lines are 3 years in recovery. The yellow lines are 10 years in recovery, and the green lines are more than 10 years in recovery. Metric after metric after metric, life continues to get better and better and better the longer you're in recovery. On all these metrics, from having my own place to live, to paying back my debts, having a bank account, paying bills on time, having positive credit, paying back personal debts, everything like going to a primary care physician, exercising regularly, etc. Each one of these metrics gets better and better and better from early to middle to late to longer recovery. Now, by the way, I would not then some individuals could accidentally take this and say, aha, we need to get you all to the dentist because that's one of the markers of recovery, and so now we're going to spend all day getting you to the dentist, and we're going to get you to this and that and the other. So I invite you to consider that this is a context of the future, that when I get well, I start doing the things that I do that keep me well, okay? That getting well helps me to get well. It snowballs. Very important to have a context of where we're headed in terms of this wellness. Very often we get caught in the middle of the addiction stage, and how do I get you from day 1 to day 10? How do I get you from day 10 to day 30? How do you get to, et cetera, and expand the amounts of time when you last used, gambled, et cetera, in varying amounts. Very, very briefly, there are many different causes of the addiction process, everything from biology, such as genes, biochemistry, brains, et cetera. Relationships, oh my gosh, there's that word again. Relationships, isolation, peer pressure, enabling with lies. Trauma, culture, socioeconomics, shame, guilt, I hate myself, and even relationship with higher power, which may have some shame. I may have some guilt. I may have some anger at God over something that happened to me. Wide range of causes. If I have a wide range of causes, then I might want to think about having a wide range of interventions. So why did I start this conversation also with good afternoon, family? Another reason is that I can't do it alone. Most days I'm a pretty decent therapist. Most days. But I don't do it alone. Do you think about who do you collaborate with? I'm really good with this skill and this skill and this skill, but you're really good with that, and you're really good with that, and you're really good with this type of client. My wife's also in the field, and we worked at the same program at one point, and there were certain clients that I could get to, and I couldn't touch other ones, and she, coincidentally, she could get through to people I couldn't touch, and vice versa. So we need to think about what our different skills are, and think about how that treats the whole person, from biology to recovery management to trauma, spirituality, beliefs, et cetera, motivation, emotions, relationships. So some example beliefs. One of the most common ones that we talk about in this field are CBT, CBT, CBT. You know I gotta love my acronyms. One of the most studied tools out there, approaches out there is cognitive therapy, cognitive therapy, cognitive therapy. Some sample beliefs are, I need to gamble. I've tried to stop, but I can't do it. If you believe that you can't, you won't, I guarantee you. Because you won't even try. It is a disease of hopelessness. Getting high makes life tolerable. I love this one. Gambling isn't the problem. I have a money problem. Gambling is the solution. Ever had somebody saying something like that? I don't have a gambling problem. I have a money problem. You don't understand. I got so much debt that if I could just win, then I'd be okay. And then I'll stop. Once I win, then I'll stop because I have a money problem. Okay? The real problem is, you see, those people out there, I'm just out of money, and if I could keep on playing until I could win, then it would be. You hear the belief system here. If I don't deal with the belief systems, I'm not going to make a change because they don't believe that they can move beyond those rules of the road. Now, so let's caution here. I love CBT, but remember for the flower from the screen before, you need to treat the whole person. We have to treat the thoughts, but if I only treat the beliefs, then medication doesn't fix those beliefs. Treatment plans don't fix those beliefs. Progress notes don't fix those beliefs. Education on the harms of drugs or gambling doesn't fix these. 4 days in withdrawal management doesn't fix these beliefs. So even if you say that is the issue, all these other things don't work for that. So we got to think about how does the whole picture fit together. Caution, if we want to treat to the core issues, how do we also help them to build relationships, establish self-respect, identify their core values, find a passion or pleasure in life? Remember when the fun stops? Okay? How do I help you to find pleasure again? This one's actually tricky. It's a much larger conversation. And how do I begin to build hope? Let me spend one more second on finding passion and pleasure. Sometimes, because of our substance use or gambling use, there are effects on the brain. I do another whole talk on the brain. But real simple for now. I might come back to it later. Sometimes when we are having that dopamine hit and the dopamine hit and the dopamine hit, our body needs to readjust because it can't get that pleasure anymore because I've gotten so regulated to having excessive dopamine levels. So as I cut back from my addictive process, I might start to feel depressed. I might start to feel grief and sadness. Okay? Very important. It may take some time to rebuild that. So think about where are we headed? How do we keep the individual at a part of our efforts? And so one of the things, if I hadn't mentioned, we're going to talk a little bit about relationships. Relationships. Consider that we've talked about my beliefs influence the treatment. My attitudes about others around the individual influence the treatment. So my client's spouse, if they don't believe that they can change, if they believe they're really just screwed up, if they believe you've stolen from me, you've lied to me so many times, I don't believe you can do this, I'm not going to risk it. The beliefs of those around us make a difference also. Now, so you may have heard this thing called recovery capital. One other thing to think about with relationships is that this recovery seems to connect deeply with these things called relationships. So when I have substance use and sobriety, achieving abstinence, but then there's also the recovery experience, like having life purpose and optimism. Then there's things like global health psychology, like confidence, social support, like positive relationships. Not only that, but at the highest levels here, citizenship, a sense of belonging, of social connection. That as I want to continue to expand my recovery capital, it involves connecting in relationships, one by one and as groups. You may have heard of this fellow. He's a fellow by the name of William White. He's a leader in the field in recovery practices. And there is also a assessment tool to take a look at what is your recovery capital, what are your skills that you bring to the table, what are your strengths that you bring to the table for this recovery thing. And many of them do include similar things that I've been talking about here, such as isolation and connection. I feel like I have a meaningful, positive communication in my family and community. I have friends who are supportive of my recovery process, etc. Hopelessness. My personal values have become clearer. I now have goals and hopes for my future. I know that my life has a purpose. Very important. These are things that we're moving people from hopelessness to beliefs of hope. So what can I do today to begin to instill some of these things in the treatment room? Something to think about. One of the first things we can do, we know that as counselors, our role is to foster individual change, to model a safe and trusting relationship. Safe and trusting relationship. They're not going to tell me things until they trust me, right? Anybody have the experience you were treating somebody for 6 months, and then one day they come in, and they sit down, and they pull up the chair, and they look a little different. They look a little green. And you know it's going to be that conversation. That I've been working with you for several months. I've been building this relationship for some period of time, and now you're ready to tell me about the trauma. Got it? Sometimes it takes time to build the trust in the relationship for us to be a safe space where they feel safe to talk about the thing that they're afraid to talk about. Maintain cultural competency and context. Very important. What works for me is different from what works for you. It works different across, that's a whole conversation, that's a whole training to itself, of course. Age, race, gender, et cetera, et cetera, et cetera, et cetera. So some of the things we know that certainly work, you may have heard this thing called empathy, warmth, genuineness, open communication. What can we do today? Start here. Do I meet you as this person, this client that's angry and some pain in my something, or walk in and say, my gosh, how can I help you today? How can I help you today? What is it that's hurting you so bad that you're acting that way? How can I see through the distressing disguises to see the you in the relationship there, underneath that superficial self? Open communication, creating that safe space. Being consistent, having courage to explore those scary emotions with them, because they may not have that courage yet themselves. So I'll invite you to consider another acronym of the day, brief solution-focused therapy. Over the years, my preferred acronym has changed through the years. I certainly am a fan of brief solution-focused therapy. It took me some time. I started off and have filtered through various ones of these through the years. But there are a lot of things that are important to understand, not that I'm not going to talk about your past, and not that I might not be with you for quite some time, but there's some values in understanding that people can change and that people can change quickly, and you might be surprised at how quickly they can change. And if we have a belief that they can't change, they won't be able to change them. If we have a belief, check this one out. Anybody believe that we can change, but it takes a long, long, long time? And if I believe that you can't change for 5 years, then I'm going to treat you differently, thinking that you can't stop gambling for 5 years. Okay? So what does that mean, and how do we begin to build some of that? How do we begin to think about their strengths, their resources, their accomplishments, and build those relationships and hopes? Some of the questions that we ask can build by the question that presuppose the change and the client's capacities. I'll be talking more about that in a few moments. Think about that. How do we ask questions that help them to understand that change is possible? Well, I've been gambling every day for the past 20 years. Every day? Okay. What was the longest time that you went without gambling? Well, there was about 7 days that I didn't last year. Interesting. So you can go 7 days without. What was going on then? Tell me about what works for you in those 7 days so that we can learn from that 7 days and leverage that and grow that and build on that today. You see where we're going here? The question itself presupposes that change is possible. Help me to understand what helps you to that change. And let's build some things today so you can feel competent, so you can know, now but notice what also happened here. You know that 7 days is possible, so I can elicit that change work with you, that 7 days is possible. Let's do another 7 days now. And let's learn from it so we can maybe get 8 days to that this time. Got it? Emotions. How do we move from external interventions to managing the internal work of the client? So sometimes we often have these external interventions. We have like things called prison. We have like things called, the court system. We have things like self-exclusion criteria, that these external controls are going to control us from gambling, right? How do we move from I'm using those external controls, which are valuable, to an internal knowledge of my cravings, knowledge of my impulses, and trust that I can recognize them and choose differently when they come up? Okay? This is the work of therapy. How do I may begin with external supports, but how do I begin to elicit that internal change? I put to you that there's another issue that goes on here, is that very often we get busy talking about our past. Well, this is because my wife did this to me, and this was because this one did such and such to me, and you would too if you had a boss like that, et cetera, et cetera, et cetera. And that place, they stole my money. No, you handed them money. Well, I'm not going to fight with you. They didn't steal your money. You handed it to them. Versus the future. I don't believe this can change. I'm not going to change until I win, and if I win, then I can change, then I can get that vision of the millionaire lifestyle, right? And where I'm doing all this past and future stuff, I'm teetering, tottering, and I never get in the present. By the way, we've been talking about past, present, and future already. I put to you that getting into this present moment may be the most important thing you can do. I invite you to consider that you will never find happiness anywhere except in the present. Think about it. I can remember my wedding day. I can remember, but I'm experiencing that pleasure in this present moment. It only exists in the present. I can bring my guilt and shame and fear and all that other stuff in the present as well. But the only place I can have happiness is in the present. The only place I can hug my loved one is in the present. How do I get past the worrying in my life and get into the present? And by the way, if I'm living in the present, hanging out with a bunch of friends, hanging out with family. One of the reasons I'm here today, all the way from Pennsylvania, is because I was here before. And in my present moment, in my time before, I remembered the group that was here. I remember the leaders that we have here, some of which we've been talking to today. That this is a place where there's a place of healing. This is a place of those relationships. And as we heard somewhere today, some wise person said, once you've been here, you're here now. Whether you've been here before or you're new. You belong here. So we got to stay in the present. Once you've tasted it, it may call you back again. I invite you that this is, by the way, part of the therapy process also. How do I begin to unhook a bit from the past? I need that vision of the future, but I'm going to not live there. I'm going to live most predominantly in the present. How do I begin to do that? How do I begin to wake up from that autopilot to get a little bit of pleasure and joy again? To sit with my counselor, who I actually appreciate and respect. How do I do all this? I put to you that there's a couple of simple ways we're going to talk about with this, one of which is simple. Some people say it's 12 steps, some people say it's 5 steps, some people say it's 3. I'm saying 6, everybody's got their own steps. So for the steps for today, for this hour, step number 1, we're going to wake up. Anybody been living on autopilot? Anybody here been living in an autopilot? You know what I'm saying? You start going through your job and let me get through today and let me get through this hour. Oh my gosh! And it's like, anybody get into autopilot? How do we wake up from autopilot? Number 1. Number 2, once I wake up from autopilot, then I have the opportunity to live in the present. One of my old mentors, she used to talk about gambling as gambling in the ozone. That may come back in a moment. That sense of kind of zoning through the experience, zoning out from the pain. I may at that point need to get a little bit freedom from the past, create a vision for the future, but set my path on today for the proper tomorrow. Today is the culmination of all the steps in your past. If you don't know where you're going to wander somewhere that you didn't expect, which may not be where you need to be. So you do need to spend a minute looking for where do I want to be in the future, because then I may not be able to get to the stars, but at least I can get to the moon if I know where that edge is, if I know where I'm headed. So we do need to at least touch on the future. We don't need to forget about the future. And then we live our today, and then repeat and repeat and repeat. We're going to be talking about that. So just for a simple path, remember I said you don't want to get rid of fear. This is a context for everything I'm about to say for the next bit of time. This is for stress, but it is very much the same. If I have zero stress, it's actually down here on the lower left here of the bell curve. If I have zero stress, I won't get out of bed in the morning. I will have zero productivity. It's like, hey, I'm in bed. It's comfy. I'm going to stay here. Right? If I have a little bit of stress, I'm laying in bed and I say, you know what? I'm getting hungry. I guess I better get out of bed so I can eat. So I'll go down and get out of bed. So my motivation goes up. I go down the refrigerator. I go down the refrigerator and open it up and I say, shoot, there's no food in here. I guess I better get to the store so I can get some food so I can eat so I don't die. Get to the store. Oh, my wallet's empty. I guess I better go get a job so I can get some money so I can get some food so I can eat. See what starts to happen here? We don't want to get rid of all of our stress, or we would sit in bed all day long. Now, this is called eustress. That's the definition of it. Basically, that the more stress you have that is motivating, it gets you up and going. There is a certain point where you hit what we call peak performance, and any stress beyond that, notice it is not the stressor, it is the amount of stress. Any stress beyond that peak ability is called distress. This is when you get all the things that you think about with stress. Oh my gosh, I'm going to have heart attacks and pains and everything else under the sun. Burnout, et cetera, et cetera. I would invite you that our goal is not to get no stress. Our goal is also not to be at the very top there. Our goal is to be in that target area just below there, because there will be a natural ebb and flow of our stress. So we don't want to go over stay at the peak top, because we'll always be tipping over into the distress side. Got it? So this is, when we talk about stress management, we are not getting rid of our stress. We are managing our stress. How do we keep it in a balanced level? Make sense? Got it? So now we're going to apply that. So let's talk about feelings. 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 I said we don't want to have no fear, right? No fear, down on the lower left here. If I had zero fear, I would just keep on walking and fall and trip and, if I had no fear, I'd walk out in front of a car and die. Fear is there to protect us from harm. We do not want to have no fear. If I had an excess of fear, it would look something more like deer in the headlights. Quick, freeze, don't move. It won't hit you. Also putting me at risk that I'm going to die. You do not want to have no fear. You do not want to have excess of fear. Oh my gosh, it sounds like we're trying to balance our fear levels just like we balance our stress levels, right? Because if we balance that, then we get to this thing that we're going to call courage. Okay? Courage is not the absence of fear, but the balanced levels of it. So, by the way, this is a whole master's degree that I'm covering here in 10 slides. Okay, so I'm happy to have these conversations after this good introduction. Okay? Anger, same thing. You don't want to have too much, we don't have too little. If we have too little, that's called passivity. If we have too much, it's called aggressiveness. Somewhere right in the middle there is what we call assertiveness. Drive. I know what I want. I'm all about, I have my vision, and I have my goals, and I'm willing to go get them. Right? Not too much, not too little, just right. Joy, when the fun stops. Oh, come on, Ken. You can't tell me there's too much joy. I can't possibly have too much joy. Well, maybe. There is such a thing called bipolar disorder. There is such a thing as an excess of joy. We may come back to that one. Okay? We'll go all the way around, but you begin to get the picture. Compassion, not too much, not too little. Sadness even. Who would want to have sadness? I put to you that our sadness exists in direct relationship to the love that we feel in life. I had excellent conversations this morning about the grieving process of something that seems like we shouldn't care that we're losing that behavior, situation, history. But my loved one is directly in relationship to the preciousness of this present moment. Got it? The love that I experience is in direct relationship to my present moment with this authentic relationship. Okay? Very important. So let's build this out a little bit. Joy versus boredom. This is my version of the feelings wheel. There are dozens of these out there. There are reasons why I have created it in this format. You can begin to see that there are positives and negatives to each of these, so we can begin to help individuals to identify their feelings. By the way, we may come back to it. New clients, I wouldn't necessarily start here. I might start with mad, sad, glad, scared. You know what I'm saying? They may not have a language for their feelings. They may have been numb for a period of time, so we might start with the simple feelings list. Once we do that, I will often quickly be moving into conversations about, emotional circle. I may be moving quickly in conversations about, here's a range of feelings. Tell me about which ones do you see? Well, I'm mad. Okay, great. So you're mad. So let's take a look at some of these feelings here. Mad, rage, hate, temper, jealous, etc. What else do you feel? Well, I'm also a little bit scared that I'm going to get found out. Oh, that's a different conversation, isn't it? What happens if you get found out? Well, I might have to give up my gambling. I might have to talk about being hurt. Oh, so your mad's really about being scared and hurt. Okay, now let's talk about what's real. See what just happened here in a few seconds. A completely different conversation, but we're now no longer talking about your anger. We're talking about the roots of these anger and how these all relate to one another. Okay? These emotions all relate to one another, and that's why they're in a specific circle in a specific order. So how does this play if this was, for example, an addiction recovery process? I might have fear, such as fear of being caught, needing the courage to ask for help. I might have anger at myself or others or the world. I might not be able to see a vision of my future. I might have isolation and hunger for pleasure and connection because the fun stopped. Versus how do I build that partnership? It may begin with my provider. It may begin with my counselor. You may be the first authentic relationship that they've had in a number of years. Okay, got that? We may be the first authentic relationship they have in a number of years. This is the opportunity that we bring to the table. What about sense of selfishness or self-focused? Because when you're in the middle of the addictions, all I'm thinking right now is how do I get my next dollar? How do I get my next game? How do I get my next? And when I'm doing that, am I sitting and thinking about my loved one? Maybe not at that second, so much as I'm afraid of getting caught. Versus how do I begin to get my head out of something and be willingness to look for the act in the sake of the other. The 12th step in the step traditions talks about giving back. This is a natural part of the process. It doesn't start on day one, but how do I begin to get out of my own self and see the larger purpose and build that relationship to others? How do I move from hating myself and shame to grieving my losses, as we've heard this morning, and believing that I am worthy of recovery? How do I build that respect rather than that sense of I'm not worthy? If I don't believe I'm worthy, that's a problem. So, I'm going to go around the circle a couple of times just because that's one of the ways to keep learning it and to grow the conversation. So with the lower left, the fear, the challenge is I may be frozen in an addictive pattern. I've been doing it day in and day out. I can't get out. I'm in this hamster wheel, frozen in the same pattern. How do I create new possibilities? How do I figure out the why and the cause of those motivations and find hope for alternatives? This is what I've always done. This is what I've always done. This is what I've always done. Well, what if you did something different? What happened on those 7 days when you weren't gambling? I'm creating possibilities for you. I'm helping you to think outside of your frozen pattern. There are dozens of tools that will work for each of these, one of which might include things like rest, sleep, journaling. These are issues about resting and calming down to get back into that creative mindset. How do I create a vision? Lack of confidence. How do I find that vision of my next steps for change? So I'm here because I don't know what to do, right? So help them. Help them to create that vision. Well, what do I do next? What's the next step that's in front of me? I may not know all of where I'm going yet, but can I help you to see what's the next step? And what's the next right step? And what's the next right step? And all of a sudden, you got day 8, and you never had day 8 before. You know what I'm saying? Joy. How do I find healthy pleasure? How do I get the fun back in relationship? That may start in relationships. There may be other ways to have fun. How do I identify my self-defeating beliefs? Oh, that cognitive therapy thing. How do I believe that I can and I'm worthy? How do I find how do I fix those pro-social values? How do I find new values that permit me to forgive and let go of my past? Anybody here ever get into an argument with somebody over something that happened before? How do you forgive and get past that wound? This is the work of therapy. Well, you can never forgive this. What they did to me is unforgivable. Okay, so it's unforgivable. So is your continuing to be angry at them hurting them? No. Is your continuing to be angry at them for this unforgivable thing that they did 20 years ago hurting you today? Yes, it is. Sometimes it's not the snake bite that kills us, but the venom that's left behind that we carry along long after the wound has occurred. Sometimes we carry that venom, that anger, without knowing how to let go. Letting go process, that grieving process, is particularly important here. One of my favorite tools for that side is also one of the best tools I have for getting into the now, meditation. So we have a wide range of tools. So begin to think about this, few ways to use this tool. Begin to think about this in terms of strengths and weaknesses. And I invite you to think through this from yourself. We're going to go around the circle real quick. Oh, yes, you. There are no safe seats in the crowd. If you're falling asleep, this is the time to wake back up, get right back into it, because this is how you're going to change yourself so you're going to be different on Monday when you go back to the office. You know what I'm saying? Whatever the day is you go back in. So, fear and courage. Is this area, do I have an excess or do I have a deficiency here? Am I running around scared in life? Or am I that person that kind of runs out, taking charge, leading? You know, what about anger and drive? Do I have a clear vision and I'm the one that's leading the charge of the vision? Or am I passive and hide and nobody knows me? Do I get to have a little bit of fun in life? Or am I bored and exhausted with a lack of joy? Am I compassionate? Am I compassionate? There was a colleague of mine, I'll leave it for a second, that just, how do you embody that sense of caring? You know, that when you meet this person, you might have met some of these people here even. It might have been said sometimes this morning that this person just embodies this compassionate heart. Self-respect. Somebody who knows their values versus being in grief. So something to think about. Which ones might be low and which ones may be high. You may find that there's a pattern that starts to emerge, and if you have questions, I'd be happy to help tease that out with you individually. But for right now, begin to think about what that looks like for you. More than likely, you are probably a little bit to an excess on 2 of these and to a deficiency on 2 of these. Maybe 3. And that will be on one side of the circle or the other side of the circle. Check it out. So let's play with this for a second. Let's take up to an example client. So we have a 32-year-old male with a history of sports betting. Yeah! Go, 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 yeah, yeah! You may know somebody like that. Symptoms of impulsivity, gregariousness, irritability, racing thoughts, fear of being found out of the financial losses. So you have excesses over here, you have deficiencies over here on this side, longing for family, ignoring my family, feelings of instability, guilt over my failures. But we're not going to talk about that. I'm just going to live my life in the next day. You may have heard this contrast. We've sometimes talked about it in terms of action betting versus escape betting. So we may have the bookend here, but very different type of gambling experience. This one is a 52-year-old female using slot machines, stealing from her church to fund the gambling. Symptoms of being frozen with fear, passive, unable to ask for help, isolated, lonely. So you see a very different picture here where the excess is on the other side of the spectrum. Got it? So this isn't the person that's up and running and joyful, right? This is a passive. You may have seen somebody around, not recently, but you may have seen somebody around or that image of someone sitting at the slots going, in that ozone. This isn't passion. This isn't joy. Got it? Completely different aspects here, different tools to work on in the therapy process, right? So completely different picture. And I'm, again, comparing, contrasting just to build the awareness. So begin to go to, let's build out some of these tools just a little bit. So first one on the lower left, feel. How do we build some courage? There are a range of tools, everything from rating my fears on a scale of 1 to 10. What are you afraid of? 0 to 10. Exposure tools. Another one I love is called grandmother. I call it grandmother hug. Imagine yourself with, maybe for you it's not grandmother, but I'm scared of snakes. I'm scared of going out in public. I'm scared of speaking in public. Oh my gosh, all these people here. So the practice is, imagine that, for some people it's a grandmother, some people it's an auntie, some people it's somebody else, that person that just comes up and gives you a big hug and all of a sudden you just know it's okay. You know what I'm saying? As you recall that memory from your past, all of a sudden that emotion gets brought into my present moment, right into the now. So if I am having a deficiency here, causing all that excess fear, I can begin to balance that with a bit of the compassionate care in the upper right there of the grandmother hug. You may begin to practice some things like affirmations such as I am courage, I'm trust, I'm flexible. Notice what happens again as I practice my beliefs. I may not be able to, even if I don't change that belief yet of I don't have a gambling problem, I have a money problem. When I start practicing beliefs about trusting, about I can change, I can do this, I can begin to make shifts. Come on. Anger. So identify some of the sources of my anger. deal with my breathing. Breathing is one of the first things they teach you for anger management, right? Take a deep breath. I say that's good for a lot of things, but take a deep breath. Identify decisions and solutions. Physical exercise, journaling, planning. See how these are all things that are about assertiveness and building our sense of self. I'm going to take a breath. I'm going to come back into this present and assert my breath. I'm going to assert assertiveness training. Affirmations like, I have a clear vision for my life and I can ask for what I need. Have you seen that in a client or in their spouse? Afraid to ask for what I need. You know, if I ask him this or her this, she's going to yell. She's going to get upset. I can't talk about that. How do I begin to build these things from deficiency into balance? How do I begin to move and build a little bit of fun when the fun stopped? How do I identify pleasures? This may start with as simple as smiling. It's free. Do you ever smile at a client? Got it? How does it feel? How do they react? By the way, I didn't do this whole talk on the brain, and there's these thing called mirror neurons. That means that when I see you smiling, it lights up the part in my brain that's about smiling. Got it? Mirror neurons. Fun fact, tell your friends, impress your friends. It's fun. Compassion. Touch, hugs, donating, volunteering, gifts freely given, grounding techniques. I'm stable. I'm not anxious, the opposite of being anxious. I'm compassionate, to give you a big hug, to wipe away the tears. I have all that I need, and that's why I can give to you, because I have this sense of abundance rather than trying to, not move beyond these deficiencies that I've got, these debts that I've got. And last but not least, how do I identify my values? How do I begin to identify my needs versus my wants? I may have some grief and I need to, for example, write a letter to someone that hurt me years ago. That person may or may not ever get that letter, that may be burned. But how do I begin to ease that poison from myself and use that F word, forgiveness, so that I can heal, so that I can let go? Forgiveness isn't about absolving them of their sin. Forgiveness is about relieving my wound so that I can heal. Let me say it again. Forgiveness is not about saying it's okay that you did this bad thing. It's about my freedom. Very important. Oh my gosh, he's going to talk about the brain at this hour after lunch. Oh my gosh. Don't worry. You'll understand. I'll make it simple. This is your brain. Okay? This is your brain. You have an urge to gamble. This is a cell up here, and it reaches out to two other cells, reaches out to two other cells, reaches out to two other cells. Got it? So this is your brain. So you decide one day to gamble, strictly speaking. And so you decide to gamble, you go get some money, you drive to the casino, you win, you lose, lose, and then you drive home. Maybe not you, but maybe somebody did. All right? So now the next day, that was so much fun, we're going to do it again. We're going to do it again tomorrow, and then we're going to do it again, and again, and again, and again, and again, and again, and again. Now, this is not a trick question here. Which of these two brain pathways is stronger, the one of the gambling or the one of the not gambling? This is not a trick question. I told you, you too can understand brain science, right? Now, I am a pacer. You may have guessed. Notice I like to walk. I like to have a little fun. So if in a bit of time here, there's a little indentation here. This is why they don't invite me for the all-day training, because the path will be worn out. If I do the week-long training, I'm like breaking through the wood into the floors. You know what I'm saying? This is what starts to happen. You start to have a little trickle of water, and then it carves out an indentation. Then it becomes a riverbed. Then at some point it becomes a Grand Canyon. Remember I said there was a difference between mild, moderate, and severe substance use disorder or gambling disorders. One of the differences is the amount of times that I have practiced this well-worn path. Once I have created a Grand Canyon in my brain about the pathway of gambling. I don't know, anybody checked recently? Is the Grand Canyon still out there? It is, okay. Shoot, oh my gosh, this is depressing. And Grand Canyon go anywhere, so two things. This is the disease model of addiction, my version. Disease model of addiction says three things. One, it is sometimes fatal. We know we have one of the highest suicide rates. Drug addiction has one of the highest death rates, which may sometimes be suicide. Fatal. It is progressive. You see how this is progressive? It gets worse as we continue to carve out a Grand Canyon. And it is chronic. So once we have a Grand Canyon, by and large, is the Grand Canyon going anywhere? Probably not. Oh my gosh, this is depressing. So maybe it's true, we can't heal. Huh. Oh my gosh, you would never thought I'd be saying that, no. So there must be a way out, if you hadn't guessed. So, one of the things we can do is we can put a dam up in the front and block the water flow from the Grand Canyon. So we don't go to the Grand Canyon anymore, although there are 50 other states that I can live for the rest of 49 other states I can and many, many more places where I can go and live a joyful life, just never going to that one particular place. Now, instead of doing that, I am instead going to go to see you for counseling. You're going to come to me for 3 days and 4 days, and the insurance company is now going to tell you, you're cured, go home, you can now be managed in a lesser level of care. Less restricted environment. Somebody may have had that conversation before. This is now a brain pathway we have developed into our recovery path. Now this is now this was 10 years, this is now 10 days. Which brain pathway is stronger? Oh, that's disappointing. So if this took 10 years to build on the left, how long will it take to build the recovery pathway on the right? Oh my gosh, that's depressing. The catch is, from day one, I'm not gambling, drinking, drugging, etc. What's happening here is not that I have to wait to 10 years to get happy again. What's happening here is that every day gets easier. Remember I showed those conversations for a reason about what life looks like over 10 years in recovery from substance use disorder? Someday we'll have this data for gambling, that day 1 is horrible, by day 10 it's better, by year 1 it's better, by year 5 it's better, by year 10 it's even better still. It's almost snowballing, making it easier and easier so that the Grand Canyon is on my recovery side rather than the Grand Canyon being on my addiction process side. Got it? This is our work. The number one predictor of outcome is length of stay in treatment. Number one predictor of outcome is length of stay in treatment. Can you see why? The longer I practice this stuff, the better I get at it. And you know what I say is going to help you to get somebody to get the length of stay in treatment? Aside from funding, relationships. You know what else is going to help? Treating the whole person. By that, I don't just mean all the different pieces, but all of that emotional range that someone brings, helping them find a little bit of joy in their life, helping them find that richness of that emotional range. By the way, this is also true not just for this, but think about this conversation that is also, you've learned things from today, from all of so far today, and for the next day and a half. So you've learned it, so you are all now in this little section here of a new learning. So I invite you, as I said, that this is not an ending, but a beginning. How are you going to take the things that you've learned here and practice it, practice it, practice it, because that's how you are going to become a better counselor and better able to help whoever you come to next. So if we want to apply this brain science to our clinical practice, identify the proper goals, identify the vision of the future, and then practice, practice, practice. And then let's build some supports for them. How do I help you to get from day 1 to day 2? What supports do you need? We heard examples today. Well, I'm not going to go to the inpatient facility even though I'm suicidal. Well, I'll sit there. I will talk to you. Well, that's my first support for today. I'm going to have a family member that's going to sit with me 24/7. Not making it right, wrong, or indifferent. I'm just saying, so this is my plan. This is my vision. And then I got to day 2. Then I got to day 3. Then I get to day 4. My vision to you, by the way, was to get there as quickly as possible because you've suffered long enough, and I want you to feel better now. And because you've suffered long enough, I'm going to give you homework. And by the way, I'm going to give you homework. I'm going to give you an invitation if you hadn't already heard it, because I said it once before. I'm going to continue to have this conversation that what you're doing today, you carry forward. Please, I don't care if it's one of my things or for somebody else, but take something you learned today or tomorrow and practice it and start to build another future. I remind you that we are here because the people we serve can change if we reach the heart of their issues. Our belief that the individual can change is central to our work. I hate reading to you. The relationship with an individual is the pathway to their freedom. And we want to develop a rounded approach with a range of emotional causes and strengths. I invite you to have one more question for yourself because this is about you. What is one thing that you've learned today that you'll use on Monday? What is one thing that you've learned? Commit to it now. Write it down real quick. It only takes a second. Actually, writing it down makes it 10 times more likely you're actually going to do it. Just pick one. I don't care which one. You heard a dozen things in that toolbox that I went around the circle. Pick one that you want to do and you're going to implement. I'm going to try this one thing with this client on Monday. I'm going to do, oh my gosh, I'm going there. I'm going to do this one thing with my spouse on Monday. I'm going to listen to my spouse for a conversation. I'm going to walk in and say, good morning, and smile at them. What's one thing that you're going to do? Commit to yourself. Go for it. You may find other things over the course of the next 2 days. I put to you, as we continue this conversation, that the important piece is not to get lost in the small minutiae, but to remember that we are seeking the heart of addiction, the heart of recovery. As we get to the heart of this work, we can be more effective. I submit to you that gold standard or high standard, shall we call it, has to do with the relationships that we build, the emotions that we bring, and the heart that we bring to our work. This is not an ending, but a continuing of the conversation. As I mentioned, I love this stuff. I can talk about this forever. Here's references, and I can always love to hear from folks. So please, please, please catch me. I won't be here tomorrow, but I'll be here all day today and love to talk about this stuff. And please, make this an ongoing conversation and continue. And thank you, thank you, thank you for the work that you do every day, because we need more arms and hands. Thanks.